Assalamualaikum everyone. I am Mohammad Foisal Imtiaz, Department of Pharmacy, B.Pharm Professional Part 3, Jahangirnagar University, Savar, Dhaka. So here's my proposal that belongs to the title Computational Assessment of Tau Protein Targeting Neuroprotective Phytochemicals for the Development of Therapies to Stop and Halt the Course of Alzheimer's Disease. The background, Alzheimer's disease is a progressive neurodegenerative disorder that affects millions of people worldwide. It is characterized by memory loss, cognitive decline, and behavioral changes. On the out of the hallmark features of Alzheimer's disease, the accumulation of tau protein tangles in the brain disrupt neuronal function and communication. Despite extensive research, there is no still cure of Alzheimer's disease. Current treatments are primarily focused on the symptom of management rather than addressing the underlying causes. The pathophysiology of Alzheimer's disease is mostly attributed to tau protein hyperphosphorylation and aggregation. So high expense protected timescales and high failure rates are just a few of the difficult that traditional drug discovery technique for Alzheimer's have had to overcome. So moreover, a lot of synthetic medication have negative side effects and low effectiveness, although the neuroprotective qualities of natural substances, especially phytochemicals, have shown promise their potential as a treatment of tau disease has not yet been thoroughly investigated. So research hypothesis is conclude the premise of this study is that the tau proteins may interact with specific neuroprotective phytochemicals to stop them aggregating, providing a new treatment approach for Alzheimer's disease. Our goal is to find and access possible phytochemicals that can target tau protein and alter its activity using computational methods. Objective of this paper: CAT modeling of multi-target ligands in Alzheimer's disease. 2. Target studies and experimental potential of Alzheimer's disease treatment. 3. Finding and improving protein degenerate targeted by neurofibrillary tangles of tau protein. 4. Protective properties against the neurological dysfunction associated with NFTs of Alzheimer's illness. And 5. Progression and potential contribution to pathogenesis of Alzheimer's. Methodology overview. To achieve this objective, the research will be divided into four main phases. Number one, data collection. Number two, computational screening. Number three, molecular dynamics simulation. And number four, pharmacokinetics and toxicity assessment and preparation. We will start by building a comprehensive database of phytochemicals known for their neuroprotective properties. This compound will be sourced from publicly available datasets such as PubChem, ChemBL, and specialized phytochemical libraries. And the tau protein structure will be retrieved from protein data bank, focusing on relevant domains implicated in Alzheimer's pathology. Involves molecular docking studies to predict the binding affinity of phytochemicals to the tau proteins. Docking simulation will be performed using tools like AutoDock-Bina, Pyrex, Glide to identify potential inhibitors of tau aggregation. Key parameters such as binding energy, interaction profiles, and binding modes will be analyzed to shortlist promising candidates. Dynamic simulation will be used to assess the stability and conformation dynamics of the tau phytochemical complex by IARCO. This step is crucial for evaluating the long-term stability and efficacy of potential drug candidates. Once we identify promising phytochemicals, we'll assess their phytochemical properties using in silico admit by Swiss Academy and Protox to analyze absorption, distribution, metabolism, excretion, and toxicity. Expected outcomes of this research include: number one, identification of phytochemicals with strong potential to inhibit tau aggregation. Number two, comprehensive data on the binding affinity and interaction mechanism of these phytochemicals with tau protein. Number three, a short list of lead compounds with favorable pharmacokinetic and toxicity profiles which can be further validated experimentally. Number four, ultimately this study aims to contribute to the development of novel plant-based therapeutic studies for Alzheimer's disease. Is significant for several reasons. Number one, it leverages computational techniques to accelerate drug discovery, reducing time and cost associated with experimental trials. Number two, by focusing on natural compounds, we aim to identify safer alternatives with fewer side effects compared to synthetic drugs. Number three, this study could pave the way for innovative therapeutic approach targeting tau pathology, potentially leading to more effective treatments for Alzheimer's disease. Research has great potential. There are challenges to consider. Number one, the accuracy of computational prediction may be limited by the quality of available data and algorithm, also cost of simulation and budget. Number two, the in silico results need to be validated through in vitro and in vivo studies, which may research intensive. Number three, there is a risk that identified phytochemicals may have poor viability or unexpected side effects in clinical setting. If successful, this research can be extended to explore combination therapies using phytochemicals and existing anti-tau drugs to enhance efficacy. We plan to explore the application of artificial intelligence and machine learning to improve the accuracy of compound screening and prediction models and mice models to in vivo analysis. Also, the power of computational techniques, we aim to identify novel natural compounds that can stop or halt the progression of Alzheimer's disease. Finally, thank you for listening to my presentation. I am now open to any questions or comments you may have.